Hi, it's the nursing professor here, starting our road to finals. All right, so the plan is that we're going to address areas of the finals that you should definitely know as you prepare for your finals. So the first topic that we're going to talk about is burns, because this one was actually requested from a viewing student. So when we think about burns actually address a lot of MedSurg problems. So just by studying the burns, you really are preparing yourself for MedSurg final. It addresses fluid electrolyte imbalance. It addresses airway, nutrition, wounds from the actual burn itself, pain management. So all of those things are associated with burns and the recovery of them. So we're going to address those. Two concepts that you should remember as we start, and that's race and pass. Frequently, those concepts come up with questions about safety. Race, remember, is rescue, alarm, contain, and extinguish. When we talk about extinguishing fires, we go and get the fire extinguisher and we remember the acronym PASS. PASS means you pull that little needle out, you aim at the base of the fire, you squeeze the nozzle, and you sweep side to side. All right, got that. All right, so let's classify these burns. First is first degree burns or superficial burns. We've all had one of these before. This is when that top layer of skin has been injured, epidermis, lots of pain, lots of nerve endings there. So people do experience quite a bit of pain. And you can probably remember that from using a curling iron or ironing your clothes or touching your hand on a heated surface. Any of those things can cause a superficial burn. Okay. Partial thickness, things get a little more serious. That's the epidermis, and part of the dermis has been impacted. Again, very painful because of the nerve endings that exist in the dermis and epidermis of the skin. This is where you're going to see some moisture coming from the burn area. Blisters are always considered second degree, not first degree. And so many of these would require dressing of some sort, and we'll talk about that in a few. Full thickness, third degree burns, these are the most traumatic, the hardest to heal, because the person also is going to have associated systemic problems with these types of burns because they're so complex. Person can have pain. Some areas might not be so painful because they'll go beyond where the nerve endings are. So they can go down as deep as muscle and bone. Skin can get really leathery, black, or it can be very, very white, but very fragile. And as they heal, it's very disfiguring. All right. So superficial, partial thickness, full thickness burns. Then we move on to measuring burns. And so the first way is really down and dirty. It's called the rule of nines. This is where you estimate based on body regions. So head and neck would be 9%. Each arm would be 9%. Each leg would be 18%. The front of the torso, another 9%. The back of the torso, another 9%. That'll give you 99%. And then the perineal area, if it's involved, would make that 100% of the body. All right. I remember that from 30 plus years ago when I was actually in school. A more accurate way of measuring would be called Lund and Browder chart. And usually that's in your electronic medical record, and you will see how you would check off the associated findings such that you can get a more accurate measurement of the areas that have been burned. And it really does work a lot better with children because the rule of nine sometimes can be really off with children because of their body size. All right, one more method of measurement is the Palmer method. Don't see that very often, but basically it's this. You locate the burn, you take the person's palm, you put it over the burn. If there's still some showing, then you put another palm here. And each time you put a palm over the edges of the burn, you're counting that as 1%. So you don't use that very frequently at all. So phases of burns, number one would be the emergent resuscitation phase. This is where you have to act right away. We're talking airway involvement. We're looking at ABCs. We're talking about replacing IV fluids like lactated ringers. Lactated ringers is usually the fluid of choice to replace. Foley catheters are inserted, pain control, tetanus. We're monitoring their airway because usually at this point, then the airway can become compromised and they need to be intubated. Signs of airway disturbance can be, you see facial burns, soot around the mouth, hoarseness, stridor, restlessness because they're not getting enough oxygen. So we want to pay attention to that. Number 2 is the acute diuretic phase. This is when that person is losing all kinds of fluids, electrolytes, and again, they need to be replaced. In the early stage, person becomes hypovolemic because they're losing so much fluid. And in the later phase, they're losing both potassium and sodium. And of course, those will be replaced. In the third phase, which is the longest phase, is the rehabilitation phase. This is when the person is starting to heal. It can take quite some time for burns to heal. We need to look at recovery, where we're going to consider the nutritionist, the physical therapy, the occupational therapy in order to get mobility back, emotional support, because many of these burns can be quite disfiguring. All right. And so then we move on to how to care for the wounds that the burns leave. And we have a couple of methods there. One is a closed method. This is where you put topical medication on it, typically Silvadene. Remember, Silvadene should only go on the injured area, not on good tissue. And the dressing, if you have to apply a dressing, would be non-adherent. Make sure it's just not regular gauze because it's going to hurt like hell when a person has to take that off. The open method is usually for areas around the face where a topical medication is put on. Again, Silvadene is frequently used, but you don't necessarily have to put a bandage on top of it. Therefore, it's called open. Then you can have debridement, which is frequently associated with more complex burns. And that's where you have mechanical, surgical removal of the injured tissue so that the body can heal a lot better. Escharotomy, remember that's a surgical incision that is placed to relieve pressure, because initially a lot of times people get a collection of fluid, edema in those areas, and they have to have room for that fluid to actually escape the body. You also think about skin grafts. Autografts is when you take skin from one site of the person, put it on the injured site. Homograft is when you take skin from another donor, a whole nother person, and you put that on the receiving site. And then xenografts are very similar, except that the donor comes from an animal, like a pig is frequently used. Those work beautifully sometimes they don't. Sometimes the body just wants to reject. So there's multiple complications that can be associated with burns. We want to know those: shock because of the hypovolemic episodes that can happen, respiratory failure because of the airway compromise, especially if someone inhales a lot of debris, smoke, fire, gets burned on their face, GI issues like an ileus or an ulcer. Infection, sepsis is often very difficult to treat with burn victims, and contractures that can happen as the body's starting to heal and they start to get scarring. And that's why physical therapy and occupational therapy can be quite helpful. So I hope that helps with you in understanding burns a little better. And if you like the video, please thumbs up. Share it with your people who are even prepping for their NCLEX, because it's pretty condensed, but it addressed all the areas. So I hope this really helps. I will see you next video, where we're going to talk about pathopharmacology, or pharmacology more so than pathopharmacology. All right. So bye for now.